Is reality an objective truth or subjective truth? Does the observable world exist outside of our perception of it? If a tree falls in a forest and no one is there to hear it, does it make a sound? This riddle, posed by the 18th century philosopher George Berkeley, questions whether the observable world exists outside of our perception of it. This is a problem which many scientists seemingly must battle on a daily basis. One such issue, which is presently plaguing medical science, is the practice of acupuncture. A 2017 article published on the news website Live Science titled "What is Acupuncture?" demonstrates this issue perfectly. The author of the article describes acupuncture as a complementary medical practice that entails stimulating certain points on the body, most often with a needle penetrating the skin to alleviate pain or to help treat various health conditions. But where did acupuncture come from and what does it do? Acupuncture originated in China in around 1200 BCE, and it focuses on the flow of qi through the body along meridian lines. There have been many studies on acupuncture and its effectiveness not only in China, but in Europe and the US, which have found it to be moderately effective in treating pain and nausea, according to the Live Science article. In predominantly Asian countries where, according to sciencebasedmedicine.org, acupuncture has a 97% effectiveness rating in patients, compared to European countries where it only has a 75% effectiveness rating, with the main effect being pain relief. In the article, an integrative oncologist, Dr. Ting Bao, working in the US, states that acupuncture may be useful in the treatment of a wide variety of pathological conditions such as anxiety, depression, PTSD, diabetes, kidney and liver disease, as well as cancer and cancer treatment-related symptoms such as nausea. She also suggests that acupuncture may be effective in the treatment of nerve damage and act as an anti-inflammatory, supposedly by acting on the neurohormonal pathways. Dr. Bao reasons that stimulating nerves with a needle through specific points in the body signals to the brain to release neural hormones which cause the patient to feel euphoric or happy, which increases their threshold to pain. Many studies have been completed on acupuncture regarding these claims, such as a 2017 study done on the effectiveness of acupuncture on people suffering from PTSD. They concluded in this study that its clinical effects are unclear and there is no significant differences in their observations of the patients. Although acupuncture is not a viable medical practice when it comes to ailments such as PTSD, it does help people with conditions such as pain caused psychosomatically. This is because of something called the placebo effect. The placebo effect is when the brain tricks itself into believing that the treatment, in this case acupuncture, works, and for psychosomatic pain, which is pain induced by the brain even though there is nothing wrong, can assist in stopping that pain. However, the claims presented in the Live Science article do not reference many scientific papers, and when they do, they often cherry-pick, even though the paper came to a different conclusion. This is seen in regards to the primary cited paper, a 2012 meta-analysis which concluded from its study that acupuncture was more than a placebo in regards to its benefits as a therapeutic therapy rather than a medical one. The article does acknowledge that the study also concluded that the differences are relatively modest, but does put a large emphasis on the positives towards acupuncture.
There are positives for acupuncture, and it has the science to back it up. But acupuncture really cannot be seen as an effective treatment beyond its placebo, as poking a needle into someone's motor neurons will not elicit an endorphin release, as suggested in the Live Science article. You're more likely to trigger a pain receptor instead. Acupuncture has been around for a very long time and has been a staple of traditional Chinese medicine since its inception. But nonetheless, it is not a medical practice. It's an alternative medical practice, and it has merit, but it will ultimately not live up to the expectation described in the Live Science article.